Hello, my name is Sarah Craven, and I'm presenting on rabies virus. Rabies virus is a virus which moves through the nerves to the brain instead of infecting the blood, which lots of viruses do. 90% of rabies cases in humans are caused by dog bites from rabid dogs. After the onset of rabies, the virus is almost always 100% fatal. There have been cases using the Milwaukee protocol in which people who were not treated for rabies beforehand survived. The best prevention at the time is vaccination of animals to prevent it in animals as well as in humans because we get it from animals. So for rabies virus, its class is flavivirus. The order is Mononegavirales. Family is Rhabdoviridae. Genus Lyssavirus. Species Rabies virus. And this picture is a picture of Rhabdoviridae. The common names include rabies virus, mad dog disease, and hydrophobia. It's called mad dog disease because oftentimes when we think of rabies, we think of the dogs that are foaming at the mouth and running around and biting people. And it's called hydrophobia because one of the key signs is a fear of water. And so when patients are given a glass of water, they will often jerk back as a reaction to the water, even if they really need to drink the water. For transmission, rabies virus is spread between organisms through the saliva via bites and scratches. If no skin is broken, then infection is very unlikely. So the virus, once an animal bites a human, the virus it replicates in the muscle or the nerve at the area, and then it travels up the nerve to the brain where it then infects it and the more serious signs and symptoms start appearing. The incubation period for rabies is anywhere from 3 to 12 weeks, and almost, as I've said before, almost always, once the signs and symptoms appear, it's almost always 100% fatal. And then signs and symptoms of rabies. Rabies often starts with flu-like symptoms, so weakness, discomfort, headache. Then there's more serious signs and symptoms, including anxiety, confusion, agitation, delirium, hallucination, and insomnia. And then there are two major types of rabies. There's the furious kind of rabies, which is what we all think of. The dogs foaming at the mouth, biting all the people. And that is considered furious rabies, and it ends up with animals being extremely aggressive, or animals and humans being aggressive and agitated. And then there's also, and that encompasses between 70 to 80% of all rabies cases. There's also paralytic rabies, which is a much smaller percentage, 20 to 30%, and it ends up with paralysis of the organism that is infected. For humans, in order to diagnose before signs and symptoms, there's multiple tests that have to be performed, and it involves checking the antibodies in saliva, spinal fluid, and the serum. We can't just do a simple blood test because rabies doesn't infect the blood. For diagnosis in animals at low risk are quarantined for about 10 days, and if they develop rabies symptoms, then they undergo further testing. If they do not show signs and symptoms of rabies, then they are released. Animals that show signs and symptoms of rabies are euthanized, and then they are tested for rabies. Since rabies doesn't present itself in the blood, it presents itself in nerve tissue. The best way to test to see if they have rabies is to use the brain tissue, and it's best to take tissue from 2 different parts of the brain. And in order to do this, it often requires decapitating the animal and then taking the brain tissue. The brain tissue is then inoculated with fluorescently labeled rabies antibodies, and then if it's incubated with these antibodies, and if rabies virus is present, then the fluorescently labeled rabies antibodies will bind the rabies virus, and you will get a picture like the one shown in the top, and that is a positive direct fluorescent antibody test. And then if it's negative, then the rabies antibodies will not bind to it won't bind to anything, and there will be no fluorescence under an electron microscope. So as I said, the best way, so for rabies virus, there's vaccines available for animals and people, and the main form of prevention is vaccinating pets, because 90% of human rabies cases come from dogs. And so if we vaccinate all the dogs, then we're going to greatly decrease the possibility of humans even being exposed to the virus. And in most cases, people will only receive the vaccine if they have been exposed and this is part of post-exposure prophylaxis. Post-exposure prophylaxis has 3 different categories. Category 1 requires no treatment, and that is if there was no breaking of the skin. Category 2 involves scratches and small bites, and it involves cleaning the wounded area very well and receiving the rabies vaccine. Category 3 involves deep bites and scratches and wounds, and it involves cleaning the area very well. The rabies vaccine and the rabies immunoglobulin given directly around the area so that the virus cannot attach. Yes, and so those are the main prevention strategies. In 2008, in Bali, there was an outbreak of rabies, and it was caused before 2008. Bali had been completely free of rabies, and before 2004, dogs were not let in Bali, and so they didn't have much to worry about with rabies coming over to Bali. But after 2004, they let other dogs come in, and in 2008, a dog from a different place came over to Bali and bit people and animals and was spread throughout the island. Initially, the government basically said, we're rabies free, this can't be rabies. But after a while, they did finally decide to say that it was rabies, which it was. And instead of doing mass vaccination of the dogs, they chose to cull the dogs, which was basically just organized killing of all the dogs left out on the street. This, however, did not stop the rabies outbreak, and it continued at high rates until Janice Girardi started the Bali Animal Welfare Association. And the Bali Animal Welfare Association went out into all of the different areas and vaccinated the dogs. And in 2015, the outbreak was still a problem, but it was a much less of a problem because of Janice Girardi's efforts with Bali Animal Welfare Association. And here are some of my sources. Thank you.